Hello, this is Dr. Clark from the Center for Weight Loss Success. I'm a board-certified weight loss surgeon as well as bariatrician. Over the past 2 decades, I've helped thousands of people lose weight and keep it off for life. One of the more important questions that I get asked around weight loss surgery is, how can I be best prepared for weight loss surgery? Very important question, and yes, we need to be prepared. Benjamin Franklin said, by failing to prepare, you are preparing to fail. So yes, preparation is very important. Now I like people really to think of kind of this in the big picture, kind of long-term success, as well as also being prepared right around surgery. Now we're not going to go too much into the big picture, long-term success here, but the 3 components for long-term success are good nutritional plan, behavior modification, kind of changing what we do, because obviously if we don't change, change will never occur, as well as working on fitness. So these things, very important for long-term success. You need to think about this. We know you're busy, but don't only think short-term. So again, long-term, very important. Short-term, obviously important too, because it's the right around surgery. That's the scary part, so to speak, of having a big operation. But the other thing, don't think just pounds. Pounds are important. I don't deny that at all. Yes, you're doing weight loss surgery to lose a certain number of pounds, get healthier, but don't think just pounds. We want you to think in kind of all the things you would also like to do. If you think about it, life is what we do second to second, day to day. Can we do all the things we want to do? Life itself isn't just how much do I weigh? What is my cholesterol? What is my blood sugar? Yes, those are very important numbers long term, very important for your health. But you also want to think of, what are all the things I'd like to be able to do? So yes, think pounds, but not just pounds. Go ahead, reach out there, draw that postcard picture of what you would want to accomplish by undergoing weight loss surgery. And weight loss is obviously a big part of that. Now, when you're preparing for that short-term thing, we're looking at, okay, surgery's coming down the pike, as we're going to be looking at this very shortly. These are some things that are very important to work on before the surgical procedure. All right, if you're a smoker, quit. And now I know that's easier said than done, but the bottom line is smoking not only impacts just having surgery from the anesthesia and all that, but also how you heal, your susceptibility to infection. There are a lot of things that it imparts or impacts influence on. So if you can quit smoking, even just for a few weeks before surgery, it's going to help you immensely. Now, especially right around surgery, you want to focus on healthy eating. Okay, because even a little weight loss prior to having surgery reduces your risk of surgery. One reason that's so important is that some of the first weight loss tends to occur across the midsection, and it tends to shrink your liver down. If you can shrink your liver down, your risk with surgery is much less. You also want to build your exercise tolerance. Now, I know many people can't exercise a whole lot, especially right before surgery, especially if you're very, very obese, very overweight. It's hard. But you want to start working on those little things. Even if it's just walking, try to work on that exercise tolerance, because if you can build that up even a little bit, it's going to help your recovery tremendously. You also want to just focus your mind on a good outcome. We need to think positive here. I know having surgery is kind of an anxiety-producing event, but you want to focus on the positive. Your feelings, your thoughts, your emotions, your attitude play a tremendous part around surgery and how you recover. It is true, we become what we think most about. Very true statement there. So you want to have that positive attitude. And with that, you want to gather support around you, whether that means joining the support group at your surgeon's office, or whether that also means just gathering the friends and family around you that'll help you with the emotional support, help you through this, because having weight loss surgery, again, is a life-changing event. So here are some things to work on before surgery. They're all important. There's not just one. But again, we do want you thinking long-term as well as the short-term there. Need more? Want more? If you'd like to receive 21 free videos on the top questions you need to ask when considering weight loss surgery, go to the website www.myweightlosssurgerysuccess.com. Want more information on the Center for Weight Loss Success? Go to our corporate website, www.cfwls.com. You take care. We'll see you at the next video.